Genomic Studies and Genetic Counseling MCQs for UGC NET Anthropology, Assertion-Reason UGC NET Anthropology. Welcome to AnthroNet Academy, a study aligned with UGC NET Anthropology syllabus. Dear learners, please subscribe to my YouTube channel, AnthroNet Academy, to keep me motivated to create more content for you. Don't forget to like, share, and hit the subscribe button. And make sure to click the bell icon so you never miss an update. Gift on 1,000 subscribers. AnthroNet Academy is excited to announce a special gift for our viewers once we reach 1,000 subscribers. Why subscribe? We're bringing you the latest current affairs in anthropology, curated specifically for competitive exams. Stay updated with exam-oriented analysis, expert insights on recent developments, daily/weekly current affairs tailored for anthropology. Special surprise gift awaits all our early supporters once we hit 1K. Don't miss out. Subscribe now, be a part of our growing community, and take your anthropology preparation to the next level. Hit the bell icon so you never miss an update. AnthroNet Academy, your gateway to anthropology excellence. Question 1. Which of the following best explains penetrance in genetic disorders? A. Degree of gene expression. B. Proportion of individuals with a genotype showing phenotype. C. Number of alleles present. D. Rate of mutation. Answer, B. Explanation. Penetrance refers to the proportion of individuals carrying a particular genotype who actually express the associated phenotype. Complete vs incomplete penetrance is key in genetic epidemiology. Question 2. Genome-wide association studies, GWAS, primarily identify A. Rare mutations with large effects. B. Common variants associated with traits. C. Chromosomal abnormalities. D. Epigenetic changes. Answer, B. Explanation. GWAS detect associations between common SNPs, single nucleotide polymorphisms, and traits/diseases across populations. Question 3. The concept of linkage disequilibrium refers to A. Random assortment of genes. B. Independent segregation. C. Non-random association of alleles at different loci. D. Mutation equilibrium. Answer, C. Explanation. It describes how certain alleles are inherited together more often than expected by chance, crucial in mapping disease genes. Question 4. In genetic screening, false positive means A. Disease present but test negative. B. Disease absent but test positive. C. Both disease and test positive. D. Neither disease nor test. Answer, B. Explanation. False positives can lead to anxiety and unnecessary follow-ups, making test specificity important. Question 5. The Hardy-Weinberg Equilibrium assumes all except A. No mutation. B. Random mating. C. Natural selection present. D. Large population size. Answer, C. Explanation. Hardy-Weinberg assumes no natural selection, presence of selection disrupts equilibrium. Question 6. Pharmacogenomics studies. A. Drug manufacturing. B. Genetic basis of drug response. C. Nutritional genetics. D. Population migration. Answer, B. Explanation. It examines how genetic variation influences individual responses to drugs, enabling personalized medicine. Question 7. In pedigree analysis, an autosomal recessive trait typically shows A. Every generation affected. B. Only males affected. C. Skips generations. D. Passed from father to son. Answer, C. Explanation: autosomal recessive traits often appear in siblings but not in parents, hence skipping generations. Question 8. The ethical issue of genetic discrimination refers to A. Lab errors. B. Unequal treatment based on genetic information. C. Mutation selection. D. Clinical diagnosis. Answer, B. Explanation: individuals may face discrimination in employment or insurance due to genetic risk information. Question 9. Prenatal diagnostic techniques like amniocentesis are primarily used to detect A. Behavioral traits. B. Chromosomal abnormalities. C. Cultural disorders. D. Nutritional deficiencies. Answer, B. Explanation: techniques like amniocentesis and chorionic villus sampling detect conditions like Down syndrome. Question 10. The role of a genetic counselor includes A. Performing surgery. B. Interpreting genetic test results and advising patients. C. Conducting excavations. D. Drug prescription only. Answer, B. Explanation: genetic counselors help individuals understand risks, implications, and decisions related to genetic testing. Question 11. Assertion: A. Genome-wide association studies, GWAS, are effective in identifying common variants associated with complex diseases. Reason: Our GWAS relies on linkage disequilibrium between genetic markers and causal variants. Choose the correct answer using the codes below. A. Both assertion, A, and reason, R, are true, and R is the correct explanation of A. B. Both A and R are true, but R is not the correct explanation of A. C. A is true, but R is false. D. A is false, but R is true. Answer, A. Explanation: GWAS uses linkage disequilibrium to detect associations between SNPs and diseases, making R the correct explanation. Question 12. Assertion: A complete penetrance ensures that all individuals with a genotype express the phenotype. Reason: Our penetrance is influenced by environmental and epigenetic factors. Choose the correct answer using the codes below. A. Both assertion, A, and reason, R, are true, and R is the correct explanation of A. B. Both A and R are true, but R is not the correct explanation of A. C. A is true, but R is false. D. A is false, but R is true. Answer, B. Explanation: both are true, but R explains variability, incomplete penetrance, not complete penetrance directly. Question 13. Assertion: A Hardy-Weinberg equilibrium is rarely observed in natural populations. Reason: R forces like mutation, selection, and migration disturb allele frequencies. Choose the correct answer using the codes below. A. Both assertion, A, and reason, R, are true, and R is the correct explanation of A. B. Both A and R are true, but R is not the correct explanation of A. C. A is true, but R is false. D. A is false, but R is true. Answer, A. Explanation: real populations are affected by evolutionary forces, so equilibrium is rarely maintained. Question 14. Assertion: A false positives in genetic screening can lead to psychological stress. Reason: Our genetic tests are always 100% accurate. Choose the correct answer using the codes below. A. Both assertion, A, and reason, R, are true, and R is the correct explanation of A. B. Both A and R are true, but R is not the correct explanation of A. C. A is true, but R is false. D. A is false, but R is true. Answer, C. Explanation: A is true, R is false because no test is perfectly accurate. Question 15. Assertion: A. Pharmacogenomics contributes to personalized medicine. Reason: R. Genetic variation affects drug metabolism and efficacy. Choose the correct answer using the codes below. A. Both assertion, A, and reason, R, are true, and R is the correct explanation of A. B. Both A and R are true, but R is not the correct explanation of A. C. A is true, but R is false. D. A is false, but R is true. Answer: A. Explanation: variation in genes influences drug response, directly supporting A. Thank you for watching. Stay connected.